Hi everyone, thank you so much for joining us this evening. We've just had a few technical issues here, so we're trying to resolve those. I'm so sorry if anybody is having difficulty where you are at home. All right, so we'll get started now, and if we have any trouble, please just pop your issue in chat and we'll see if we can resolve that for you. So welcome and thank you for joining us for tonight's webinar. We're here to explore meeting your Triennium CPD requirements under COVID conditions. My name's Hatha and I'm the CPD Program Coordinator for the RACGP WA, and I'm really grateful to Rural Health West for giving us the opportunity to talk about CPD this evening. For me, it's an exciting topic. I know it's not for everybody, but hopefully it will be helpful. So I think we can all agree that the past few years have been particularly challenging for general practice. And the pandemic has really thrown a spanner in the works for a lot of people. And among other things that it's affected, it's impacted a lot of people's ability to access CPD activities and keep up to date with their CPD. And the end of the Triennium is on its way, so that ends at the end of this year. So we thought that what we do is focus on the easiest ways and best ways for you to meet your CPD requirements by the 31st of December this year. So tonight's session is for you, and we want it to be practical and informative. So please submit any questions as you have them, and we'll take a few little breaks to answer questions throughout. We'll also leave some time for Q&A at the end. So just to check that everything's working, can please put where you're joining us from this evening, and we'll see whether chat's doing what it should. So if you can just type into the chat box where you're joining us from, that would be terrific. Okay, so far I'm not seeing any chats. Are you able to use the chat to let me know where you're joining from? All right, we're just going to continue and see how we go. Hopefully everybody's able to hear me correctly. If you can hear me, please also pop that in chat.
It's coming through in the questions section.
All right, so let's keep moving along. So I'd like to start by acknowledging the traditional owners of the respective lands upon which we're meeting this evening and pay my respects to the elders past, present, and emerging. Today, I'm on the traditional lands of the Whadjuk people of the Noongar Nation, and I acknowledge and respect the continuing culture and contribution that the people have made to the city and this region. I'd also like to acknowledge any Aboriginal and Torres Strait Islander people who are joining us today. So for a little bit of housekeeping, your feedback's really important to us. So at the end of this session, we're going to ask you to complete a survey that allows you to tell us what we've done well and what we can do better next time. So this evening, we have a few learning outcomes. They're pretty simple. By the end of the session, you should be able to list the Triennium CPD requirements, navigate to where self-directed CPD accredited activities are logged on your dashboard, and identify the COVID management CPD accredited activity. This will all make more sense in due course. So we'll start with the dry material and then keep moving along. So the CPD requirements for this Triennium are on your screen now. So there are 2 CPD accredited activities, which were previously known as Category 1 activities, and those are activities worth 40 points each. You need 2 of those this Triennium. You also need basic life support, and that's worth 5 points. Basic life support has replaced CPR, but will still accept any basic CPR activity. You also need a minimum of 130 CPD points, but this Triennium, because the college is aware that COVID has caused such trouble for everybody, we have given all GP members 25 points per year this Triennium, so everybody should have 75 points already on their dashboard. All right, so speaking of your dashboard, hopefully everybody is pretty comfortable with using it, but we'll go into a little bit more of that this evening so that we make sure that everybody knows how to comfortably use the dashboard. You can find a dashboard by going to the RACGP website and logging in, or you can use the URL that's on your screen. From your dashboard, you can see your CPD progress, and you can also log CPD activities. So you can log any basic life support, you can log self-directed CPD accredited activities, and quick log any other activities for 2 points per hour. This evening, we're going to focus on activities that will help you meet those 2 CPD accredited activities for this triennium. If you're feeling a bit lost with how to find those, hopefully you'll feel less so this evening, but you certainly wouldn't be alone. So I'm going to show you where to find some self-directed CPD 40-point activities, as well as some provider-led options. So we've got a bit of good news. There are 2 new self-directed CPD accredited activities that are on the dashboard, and those are available to everybody. Well, the first one's available to everybody. So the first one is COVID management, and it's a reflection activity. And we'll have a look at that form in a moment. But this one is actually capturing what you've already done to upskill around COVID this triennium. So it's not additional work, but there are 5 reflection questions. And then we have the Health of the Nation Business Sustainability activity. And this activity is for fellows and life members. And there is a prerequisite for the activity. So for this one, there's a time-sensitive element. So there's a Health of the Nation survey is currently out. If you complete that before the 11th of May, you can then go on to do this activity anytime before the end of the triennium. All right, so the first activity that we're going to look at in a little bit more detail is a good news story for everyone. All GPs can complete this short reflection on the changes you've made in your practice in order to deliver safe and effective care to the community under COVID conditions. The activity is on your CPD dashboard now, so we're going to go find that together and look at how to submit one of those forms. So we're just going to have a little bit of screen sharing, and I will go slowly because there's a bit of a lag, I'm aware. So just a moment while we swap this over. And hopefully this is working for everybody from home, because at present I'm not seeing any chat. So hopefully you can all now see the RACGP website. So this is what it looks like when you log into your account. And from your My Account, you can get to My CPD a number of ways. You can do it from here by clicking and then going to My CPD, or from the main screen where it says My CPD, you can select Visit My CPD Dashboard. So that's what we're going to do now. So we'll just have a little bit of a look at the CPD dashboard and familiarize ourselves first. The first thing to note is that the dashboard we're looking at just at the moment is a test account. So don't be worried that this GP has done an inordinate amount of CPD, but we'll look at what the dashboard shows you. So it shows you what the minimum requirements for the triennium are, which we've just gone through, and it shows you how far along you are in meeting them. So this particular GP has just been amazing. They're also our test account, but it's showing that they've done at least 2 CPD accredited activities, basic life support, and shows you how many points of the 130 points this person's completed. We can also look at how many hours they've completed in different categories, and we can download a CPD statement from here, and we can look at all of the activities this person's done. But right now, what we really want to do is we want to find that COVID management activity. So when we start, we land on My CPD, and to log or find this activity, we're going to go to log. From here, we want to select Log CPD Accredited Activity, and this is going to navigate to a new page. All right, so once we're on the new page, we're just going to scroll down a little bit. And as you can see, the first option here is this new Health of the Nation activity that we just discussed. To do this activity, you would first do the survey and then go into the follow-up activity that you can do. But the COVID management activity that is available to everybody, we're just going to scroll down to COVID management, and we'll open this up. Now, this activity has been put together with the Melbourne, so our CPD team throughout the country, and our Victorian Council put this activity together because we found that our members in Melbourne were particularly worried about not having access to face-to-face education. So this activity is for any work that you've done to upskill around COVID to make sure that you're across what you need to be across to safely practice over the past couple of years. So for this one, what we'd ask you to do is create an activity title, and you can call it anything that's meaningful to you. So COVID management in my practice, COVID management 2020 to 2022, whatever seems most appropriate. You'll need to have done at least 4 hours of COVID management upskilling or COVID upskilling across the past 2 years. We know everybody has, so anything above 4 hours can go here. We're seeing a whole range of responses at this stage. Some people put 200 hours, some people put 10. It's really just an estimate of how much time you've spent. Now for the activity start date, you can either select March 2020 when all of this kicked off, or you can select the day that you're completing this form. Either will be fine. Next, we go down to the domains of general practice. And again, this is a reflection activity for you. So for some people, they're selecting all 5 domains, and some people are really sticking to the first 3. So it's about whether or not every area that's listed here has been touched by COVID, and whether you've had to think about, for instance, the organizational and legal dimensions, which many practices have, but not all GPs have. So this is for you to decide. Then we go down to the curriculum contextual units, and we're going to expand all of these. So all you need to do is select at least one across these, all of these tick boxes. You can select more than one, but you'll need to select at least one. And what most people are doing is they're selecting adult health, children and young people health, and care of older people. And that sort of just crosses all of your life segments of your patients. Some people are also selecting presentations if they work in a subspecialty. So if they worked, for instance, with cancer patients, they might select oncology and palliative care as well. And then this is the meat of the activity. So this activity isn't intended to take you hours to do. In fact, it should probably take less than half an hour to do, but everybody approaches things differently. So we have 5 reflection questions, and we just ask you to answer each. So the questions are, how have you managed the impacts of COVID-19 exposure or risk to your staff or patients? How have you managed COVID-19 vaccination and or hesitancy in your practice? Outline specific changes you've made to your practice to manage COVID-19 and continue routine patient care. Have you seen other impacts on your patients' health and or presentations? For example, changes in childhood vaccination rates, reduced cervical cancer screening, completion of diabetes, cycles of care, etc. And the last question is, list any key resource, for example, Department of Health or RACGP, that you refer to for COVID-19 information. So as you can see, these aren't super exhaustive and they're not too complicated. And some people are putting 1 or 2 lines, and some people are putting a paragraph. It's a reflection activity for you. So you pick how you respond to these. Once you've done all of those, we're just going to ask that you tick the little declaration, I agree. And you can upload files here. So if you found any resources that are particularly useful that you'd like to save, you can upload them, but there's no need to do that. So once you've completed the form, you go to the very top and select submit. If you don't have time to do it all in one go, you're going to save your draft. And when you come back to the Log CPD Accredited activity page, it's going to be sitting here waiting for you. So we looked at the COVID management CPD accredited activity with 40 points. Now that's our simplest CPD accredited activity. And every single GP can do that to meet one of their CPD requirements at a minimum. If you were in a super pinch at the end of the triennium, you could do one now and one at the very end of the triennium if you've had significant changes in your practice between now and then. But I think it's a really good idea to look at other CPD accredited activities that are self-directed that you can do. And some of these are available to do solo, and others are you could do in a group. I'm just going to have a little bit of a look because I'm not seeing any questions at this stage. And I can see one that says, hello, can you read this? So I can read that. So if people have any questions, please feel free to pop them into the question box because I can see those. So far, I'm going to assume you don't have any questions. I'm going to keep going, but I will refer back to this questions box and have a little bit of a look as we go. All right. So here are all of the CPD accredited activities that are self-directed that you can do. You can do an audit either by yourself or in a group. A lot of practices do these together. We've already looked at COVID management. If you look after medical students or GP registrars, you can use this activity. You need to have done 4 hours of teaching in order to claim this, but again, that's 40 points. If you belong to an evidence-based medicine journal club, that can be claimed for 40 points. If you do GP research, again, that's another one that can be accredited for 40 points. The GP working overseas probably isn't going to impact anybody who's joining this evening, so we might skip over that. Higher education or professional certification. This is for if you did, for instance, a master's in public health or something similar. So you could absolutely get credit for each unit you do in a course such as a master's. Peer group learning we're going to come back to because I think this is a really terrific option for people who haven't had a lot of access to face-to-face learning. So we will come back to this one. A peer-reviewed journal article. So if you publish an article in a peer-reviewed journal, we know that that's an enormous amount of work, so we can give you 40 points for that. If you engage in a plan, do, study, act cycle, again, this is another activity worth 40 points. You can do a random case analysis within your practice. Now, the specific requirements we'll hop back into in a moment. Also, there's supervised clinical attachment. So basically, if you were to select any of these activities, we're going to move to peer group learning to have a quick look at that. It gives you a guide and a template that we'd ask you to fill out. So this one tells you what the requirements are for claiming this, for engaging in claiming this type of activity. So we have a learning guide that's linked. And basically what this tells you is that each peer group learning cycle has a planning meeting, it has 4 hours of education, and it has a reflection meeting. And this could be anything from a Valent group to practice meetings that aren't just about where to park and which tea we want to buy, but that are helping you work through anything that is upskilling for you in your scope of practice. So you just need 4 hours of meetings at a minimum. They can be, it needs to be at least 2 meetings, but you could have 4 one-hour meetings, or you could have 2 two-hour meetings. A lot of practices, if they're doing this as a practice group, will hold maybe 6 one-hour meetings, so that if somebody misses 1 or 2, they can still get the points. With this one, we ask you to nominate one lead GP, and that GP makes sure that the program template is completed. And this just tells us a little bit about the peer group learning that you run. So it tells us who was at the planning meeting, what topics you planned to cover, who was at the actual meetings, and what topics were covered. And this gets completed for your whole cycle. And then it gets uploaded to this form. And we're going to repeat just as we did with the COVID management activity, selecting the domains of general practice, the curriculum contextual units, and we also have some reflection questions. So why was this group set up? And at the end, there are reflection questions that the whole group answers together. And then under participant information, the lead GP enters the details of each GP in the peer group learning, and then everybody who participated gets 40 points. So I see that there's a question now. Is there a deadline for completion for these CPDs? Okay, so the deadline for completion of your CPD for this triennium is the 31st of December this year. The new triennium starts on the 1st of January 2023. Can't believe we're saying that date already, but it's not that far off. And at that date, in the new triennium, we have a new CPD standard that's coming from the medical board. So there will be some changes after that date, but we will communicate more between now and then about that. So peer group learning is a really, really terrific way for not only you, but a group of GPs to get CPD recognition together. So we're seeing people do this in set groups that they've worked with for a long time. In the example of a Valent group, we have some Valent groups that have been meeting for 20 years. And then we have other people who meet about a specific interest that they share, or as I said, as a practice group, and really choose how you do that. I said we'd come back to specific requirements because this is a bit of a different one as well. So specific requirements are about meeting requirements across multiple colleges. So we're going to give the example of a GP anesthetist. So if you're a GP providing anesthetic services and you belong to the JCCA CPD standard, we need you to track your anesthetic related CPD across the Triennium. So if you did an activity that would be counted towards your anesthetic CPD, that could be uploaded here, and the person would select GP providing anesthesia services and attach their evidence. And then this comes through to me for checking. And so long as it all looks as it should, you get your points, and that ends up on your statement. So we've looked at how to self-record some CPD accredited activities that are self-directed. But let's also have a little bit of a look at finding CPD accredited activities that providers have put together. So we have a lot of providers that we work with, and they put together fantastic education as well. So the way that we find this is by clicking on Browse. And from Browse, to refine this to just the 40-point activities, we're going to select under Activity Criteria. We'll select CPD Accredited Activity, and then we will search. Now this is going to find everything that is accredited for 40 points. So you can see there are 383 CPD accredited activities available on our website for GPs to do. You can further refine this by topic if you wanted to. So let's say we wanted to find something on diabetes that's worth 40 points, and we're going to search again. And now we're down from 383 activities to 34. That's a little bit easier to look through. Now, this is going to show you what type of activity it is. So is it e-learning? Is it one that you can do online? Or is it blended? So maybe this one is a combination of webinar and e-learning, or it's face-to-face and online learning. Or we might have one that's fully face-to-face. Now, obviously, if it's online, it's going to be completely flexible based on where you are. So let's look at one of these e-learning activities. So if you wanted to complete this activity, the way you're going to find more information is by clicking anywhere on this tile. And it will then take you through to information about the activity, including its learning outcomes. And it's also going to tell you who to contact to enroll in the activity. So it will tell you what dates are available, if it's available all the time, if it's live or if it's a webinar. All of that information is available there, and then we can go back to our search. And if there's something that you're interested in and you just want to save it, if you click this little bookmark, that will save to your bookmarks area, and you can always look back and see which activities you thought you might be interested in. Okay, so in addition to the activities that you can find by looking through Browse, we can also look at activities that the college is holding. So to do this, we're going to click on Education. We'll go to Professional Development. Then we'll go to RACGP faculty events. So there are events that are held in each faculty, but also it's really useful to look at the rural faculty's events. So from here, we're just going to go faculty and select rural, and then we'll search. And our rural faculty has put together a combination of online learning and face-to-face topics as well. So here's one on CBT and general practice, and that's available online via GP Learning. So that's available to all members all the time. It's totally available. We have one on the focused psychological skills. Again, this is available online. Now this one's in Victoria, but we also have one in WA, which is the point of care ultrasound. So ours, I believe, is in July. So let's just scroll down. No, the one that I'm thinking of that's in July is actually this one, which is the emergency medicine for rural GPs. So this is an online activity that is another 40 points that if you wanted to do, you could contact our rural faculty for enrollment into that one. Let's have a look at, I believe it's later, must be August. There we go. So in Albany, we're having an introduction to point of care ultrasound. So if that was something you wanted to do face-to-face, our rural faculty is offering that in Albany on the 13th of August. So that's another good option as well. So let's just go back to our dashboard. Now, if people have questions, please do type them in. At this stage, I'm not seeing any new questions. We just have the one about when the triennium ends. Any others, please do type them in. So I'm going to go back to my CPD. And now that we've looked at least, so we've looked at the COVID management CPD accredited activity. So that one is one that each of you could do this evening, and you would have done 40 of your points. And if you hadn't done any of your CPD accredited activities, you'd have one more to do. So to complete that, you could do your health information, you could do a peer group learning cycle with your practice, you could do an audit. When we were in that browse section, there are a number of audits in addition to the one that we have that are worth looking at. So we have the National Skin Audit that Helios does. We have the cervical screening audit that has been very popular as well. There are lots of options of activities that you can do, and you can refine this in various ways that are more specific to your interests and your scope of practice. All right, so now that we know how to find and log self-directed CPD accredited activities, why don't we look at the other functions of the dashboard? So we have under log, we have quick log, and we have log BLS. So if you've done your basic life support, but are yet to record that, you come to log and then select log BLS. And from here, you're able to upload your certificate for your CPR. So you just call this providing CPR. You put the duration of the activity. It has to be a minimum of 1 hour, and it needs to involve practical assessment of CPR. So most activities are at least 2 hours long, but you're going to put how long it actually was. And you'll also select whether it was interactive or not. It needs to be interactive because, again, we have that requirement for the practical skills to be assessed and demonstrated. So you're going to put your start date, and for most people, the start and end date are the same, but not always. So say, for instance, you went to an activity that was across multiple days, or there was pre-work that was done online on an earlier date, and then the assessment is on a later date. These might be different. The delivery mode is either going to be, it's usually going to be face-to-face. In some cases, it's blended if, as I said, there's theory online and then practical in person. We select whichever is correct for your situation. And then we might put Royal Life Saving WA. You put the postcode where you completed the activity, and then you can attach your certificate. So to do that, you can either drag and drop into this section here, or you can select Choose File and navigate to where you've saved your certificate. And then you're going to tick your declaration and then submit. So that comes straight through to me. And each of the CPR certificates does have to be checked. So when you submit that, it's not automatically approved and showing on your dashboard and in your statement. So it does come through to a person first, and we look at that and make sure that the requirements are met. So if it's with an RTO, that will meet the requirement. But sometimes people have done it through a hospital that they have admitting rights to, or someone else, and sometimes we do actually have to check the program to make sure it meets requirements. So we've got, that's log BLS. Here we've got quick log. And quick log is what you're going to use if you have undertaken CPD that's not formally recognized, but is upskilling. So it can be either something that you've done independently or a workshop or a webinar that you attended where they didn't attach CPD points to it. So for this, you would put the title of the activity. So imagining that I wasn't already giving you CPD points for this evening, which in fact we are, but if we weren't, then we would put meeting your Triennium CPD requirements. Typing while people are watching. All right, and then we put the date, which is today's date. We put the duration of the activity, and we put a little bit of a note about what the activity was about or what we learned. And often, if you attend an event that's not formally CPD recognized, but that is a formal event, they'll send you a certificate. In that case, you can upload that here, but evidence isn't required for one of these activities. So you could self-record any webinar you attended. You could self-record journal article reading. You can self-record listening to podcasts. All sorts of things can go here. Anything you put here is 2 points per hour, and it's going to be added directly to your statement. And where that, so it shows in the main section of your statement, but you can also go to your quick log history and look at what you've added there and make changes. So from here, to change a quick log that you've already made, you click on the little pencil icon and say, I thought I should probably have attached a document here, but I didn't. I could in fact add a document. Okay. So we can do that there, and that's added that document, and then I just select update, and that's going to change and be saved into my record. Most people won't need at this stage of the triennium to be adding too much to their quick logs, because as I said, we have given everybody those 3 lots of 25 points for COVID-19 pandemic professional development recognition. So that means that if you've been a member for the last 3 years, you will have received 75 points of COVID management CPD, which means that probably your only requirements at this stage are the 2 CPD accredited activities and basic life support. Now, if you're having difficulty finding a BLS activity, the WA faculty are holding BLS training almost every 2 weeks. And so we're doing mostly Tuesday or Thursday evenings and Saturday mornings. If you're having any difficulty finding a BLS activity, please feel free to contact me. I can also help you find them if you're not. And if you're not going to be in Perth, or if you need to find something and it's a bit of a more far-flung locale, a lot of places are finding that the Royal Life Saving Society are offering quite a lot of BLS, and that's terrific. St. John of God also offered really high quality BLS. So let's just have a little bit of a look. If we have any questions, people, please put them through, because I would really like to be able to answer anything that's on your mind. All right, so we're going to go back and just refresh. All right. So let's see, can we all see the PowerPoint again? Hopefully we can. So we're just going to do a little bit of a recap of what we've gone through so far. So navigating your CPD dashboard. To log an activity, we're going to go to log. We're then going to select log CPD accredited activity if it's one of those 40-point activities we discussed. The ones that are available on your dashboard are these ones here. And I should have also mentioned, I'm so sorry, Advanced Life Support is a 40 points activity, and it also covers off your BLS. To log your Advanced Life Support course, you go to the Log CPD Accredited Activity tab, and there is an option for log BLS and log ALS. If it's an ARC course that you attended, there's a link there that allows you to request that they upload your points. If it's a non-ARC course, then you upload the certificate and we will adjudicate that for you. So we're back to these CPD accredited activities. We will be adding another one here soon on disaster preparedness, which isn't available just yet, but will be shortly. And that's for our colleagues who have been in flood and bushfire affected regions. If you found yourself in one of those situations, that will help you capture anything that you've needed to do to prepare and react in that sort of situation. I should also mention, if you've done an activity that doesn't meet any of these specified activity types, but you think has involved deep learning, upskilling, hours of work on your part, please feel free to reach out to me about that, and we might be able to get you 40 points for the activity if it meets our deep learning requirements and is within your scope of practice. Okay, so we also looked at how to look for a provider-run CPD accredited activity. So we said we're going to the dashboard, and instead of selecting log, we're selecting browse in this instance, and we're also going to select CPD accredited activity under activity criteria. And we can, of course, refine this search by adding search terms or activity type like audit, and that's going to narrow down our search a little bit. Now, I also showed you how to find some activities that are run by the college. So we said we were going to the RACGP website, we're selecting education, then we're selecting professional development, then we're selecting RACGP faculty events. And from there, we're just going to select rural under the faculty and click search. And that shows you any activities that have been designed for our rural GPs. You could also under faculty select WA, and that's going to show you events that we have locally at WA. So we have time for Q&A. That looks like we have, what do you do if you're not a member of the RACGP and cannot log in? Okay, Marian, if you are not a member of the RACGP and you are either recording your CPD independently or you are recording with another college, then you would need, so if you're recording independently, you need to make sure that you're meeting the requirements of one of the two GP colleges. If you are with another college, they will also have arrangements for how you can self-record any activities that you're doing. Are you part of our CPD program but not a member? So we have at the moment 2 categories, and there are some people who are not full members but do participate in the program, and in that case they can still log into the dashboard. If you're interested in becoming a member but aren't at the moment, if you go to racgp.org.au, there's an 800 number where you can speak to our member services team about becoming a member. At the moment, there are 2 main GP colleges, so there's RACGP and Akron. That will continue to be the case in the future, but in the new triennium, in terms of CPD, it's getting a little bit more complicated because we're moving from CPD being recorded just with those 2 main colleges to it being recorded through CPD homes. And that's a new change that the medical board are bringing in. And it's going to be a little bit of transition time, we imagine, because at the moment there really aren't any other CPD homes. So Akron and the RACGP are filling that space for GPs at the moment, and will continue to, and we'll see who else emerges in that space. So I hope I answered that question, but if I haven't, please feel free to clarify a little bit more what you were hoping I would answer. Let's see. Is there anything else that I can answer for people? Were there other questions that you were hoping that I would answer this evening that we haven't touched on yet? Because this is your time, and I'd really like this to be something where you can go away feeling a bit more empowered about your CPD and a little bit less like that triennium is coming too quickly for us all. Thanks very much for that. Okay, so the next thing to say is if you don't have questions tonight, but they do bubble up, I am around and it is my job to help you and I enjoy helping you. So if anything comes up when you wake up tomorrow or in the next 8 months before the end of this triennium, please feel free to reach out to me. So the WA CPD email address is on the screen there. That's the number for the faculty, so you can call through and you would always either be able to get myself or a CPD admin person to assist you. Very happy if you start working on something but you don't know exactly how to record it to get a call. Some people prefer Zoom, and I can always set up a Zoom meeting if you want to be shown through how to access something or how your dashboard works or where something is saved. That's my job. So if there's anything that you're stuck on, please do reach out. There are lots of people in the college who are excited about making sure that your CPD is interesting. We offer some of that education ourselves, but also we work with a lot of organizations that offer really terrific education. I wanted to just plug a little bit. Let me see, just a moment. So we go back and we'll have a quick look. All right, so hopefully it will show the screen in a moment. Yes. So if we go back to our browse and look at CPD accredited activity, and head is always an interesting thing to search, but I know that the Cancer Council, for instance, is running a really terrific supervised clinical attachment on head and neck cancer. And this is a really terrific one to get involved in because it gives you insight into some team care in a really interesting way. And so if you were looking for a supervised clinical attachment, we'd be really excited for you to contact Accredited Cancer Council. Let's see. Just trying to see if we have any other queries. So far, it looks like everybody is either really comfortable with their CPD or they don't want to ask their questions. So if you don't want to ask tonight, but you have a bunch of them, please do contact me, as I said. I'd really love to support you with anything CPD. So let's go back and share that screen again. So there are my contact details again. And I'd just like to say thank you to all of you for the really impressive and important work that you do. It is incredibly important. It always has been, but it certainly is especially so at the moment. So thank you for being out there in the community and for keeping us safe and for putting up with the very difficult conditions that everybody's working in. We appreciate you and we are here for you. So you will all get 4 points of CPD for participating this evening. So I hope that you found what we went through a little bit helpful and that you feel a little bit less lost about where to next. But if there's anything that I can do to assist you, that is what I'm here for, and I look forward to hearing from you all before the end of the triennium. Please take care of yourselves. So when we end the webinar, we will be asking you to complete our feedback survey. It's a super short feedback survey and it just lets us know what worked well and what we can do to improve. Thanks so much.